Hello, everyone. I'm Leonel August Rodriguez, the VP of Business Development for Access Medical Labs. I'd like to thank everyone for joining us on another Access Live, where we bring you insight from leading medical experts. We do ask that all questions are submitted via the Q&A, as they will be answered at the end of our webinar. So today, we have a very special individual who within his 21 years of practice has inspired, trained, and coached thousands of healthcare practitioners. He is an internationally known best-selling author and the founder and CEO of the Wellness Way Enterprises. Without further ado, live from Green Bay, Wisconsin, I present to you Dr. Patrick Flynn.
Good evening, everybody, and thank you guys so much for having me on today. I can tell you how much I appreciate Access not only as a company, but also the personnel behind the scenes that most people don't get to see. Without you guys, all of us, our clinics could not be as successful as we are. So I'm very excited to teach something that has been made over the course of 24 years. I apologize. I should have updated my bio. I guess I really don't give that much credit to my bio due to the fact that things they're going to learn tonight is, yes, my schooling is extensive, but after 24 years of clinical practice, there's nobody that taught me tonight, which I'm going to teach you. So I'm very excited to bring, what I've put together with Access to get the best clinical results. And I want to fast forward to the end before we have a question and answer at the end. The thing that I've always searched out to be, because my history being sick myself before I actually became a doc, was clinical outcomes. I know everybody here watching today wants the best clinical outcomes. So let's do this. So let's go get into the story that led to what we're going to talk about tonight. And I'm so excited because this is one of the panels that I put together, and I'm going to show you the thought process behind it. I'm going to show you why it's so effective. I'm going to show you that you can start implementing this tomorrow. So a picture up to my left here is the story that this is all based on. If I am now 48 years old, I've been in practice for 24 years. I was just getting done with college, and I met this beautiful woman that, no joke, we started dating. And on the second day we started dating, she looked at me and she said, I think I'm going to marry you. And I was so excited. I said, I think you're right. So it was kind of neat. We started dating, and over the next couple of weeks, all of a sudden, next thing you know, I go over to visit her. I'm still not even a doc yet. Go over to her apartment, just get done with my internship. And all of a sudden, I come to visit her, and I walk up to her door, and she comes to it after I ring the doorbell, and she answers, and she's standing there crying. Now, that's significant because I was wondering what's going on. We've been dating for a couple of weeks, everything like that. So she said, come in, I want to talk to you about something. Well, she started to tell me a story that she's suffering from some things badly. She sat down, she told me that her health history is she has endometriosis, which is obviously very devastating. All you guys know what that is. Also have colitis, cystic acne, and headaches. Well, what happened was she started telling me all this stuff going on that way. And I was like, oh my goodness, there's a lot going on with you. And therefore, it's very sad and it's a devastating story. And that's why I thought she was crying. That wasn't the reason why she was crying. She was crying because we just started dating over the last 2 weeks. And she said, listen, she goes, just want to let you know, after all this stuff going on, I'm infertile. They told me I can't have kids. They told me I shouldn't even try. They told me all things that were, bad. And that even if she did get pregnant, it could be really badly. It could lead to death. And just a gloom sentence. And she said, listen, she goes, and the reason why I want to talk to you about this is because I know, getting to know you over the last couple of weeks, that I know you want a big family and I can't have kids. So I'm going to give you an opportunity to lead me right now. And imagine that, guys. I'm sitting there. I'm 24 years old. And all of a sudden, next thing you know, I'm like, I had to make a choice. Well, as you can see to my left, I made my choice. That girl that I was talking about, obviously, is my wife, Christy, in the middle, and my 4 beautiful daughters. Now, believe it or not, the lab that I want to talk to you about tonight is something that I developed from this story right here. And now this lab has been run, honestly, it's probably been ran minimally 500,000-600,000 times with all my doctors, probably millions of times, to tell you the truth, if I ever want to count it. But here's what happened. And I want to show you how the evolution that came about. And I want to show you how this all stemmed from everything that was going on. And the nice thing is the clinical results I got led to me not only helping my wife with endometriosis and reversing the process, but they come up with some concepts that are not taught in healthcare today. And I literally had multiple interviews today from, no joke, a breast cancer surgeon to a person that is massive over in Germany to a breast cancer surgeon here. So I had multiple interviews just from these simple concepts. And the concepts are quite simple because you know why? because as I put these together, I started to go, okay, listen, what are some of the markers that we need to do in order to actually figure this stuff out? And so I end up, and I'm going to fast forward and start with the end in mind. And I create this panel, Adrenal. We'll send you a copy of this panel and everything like that. And it's nothing more than I sat down and started to write all the markers I believe you need to do to really figure out the female hormone realm. Now, the nice thing about is as I sat down and it evolved through the years, because of the understanding and things I was seeing, guess what happened? Our clinical results have been nothing but fantastic. Been able to predict and see some of the major healthcare issues that females deal with today, to watching them reverse, to watching everything from breast cancers, endometriosis, infertility, PCOS, cystic acne, fibrocystic breast disease, everything from this whole concept. Well, what ended up happening was, as I was sitting there, I'm like, I disagree with what your doctors say. And I started to investigate and dig into female hormones, I think, more extensively than anybody in the world. Not from the standpoint that even my clinical background, but just from the standpoint of going, hey, listen, with everything going on, we really need to dig and look at this from a different perspective. And the medical field has obviously failed her. Now, why they'd failed there is because all of a sudden I said, hey, listen, with all this going on, can I see your labs? And when she brought them to me, I was like, there were some things that were dramatically incomplete. So I started to look up, because if you look at endometriosis, and you can learn all about it, it's well documented, the majority of time, a high level of time, that there is some estrogen problem. So I started to dig deep massively into the estrogens. And the reason why I point that out completely is because, if you are a 24-year-old cyclic woman or a 65-year-old menopausal woman, you still have estrogens, not estrogen. Like if you were to look at this panel, which I have E1, E2, and E3 up there, a lot of women don't usually even understand that, estradiol, estrel, and estrone are 3 parts of the estrogen complex. And they usually don't run them because they only usually run estradiol or run estrone based on their age. If it's 24, they'd run estradiol. If they're menopausal, they'll run estrone because it's more of the dominant estrogen, but it's not all of them. So what I started to do is I started to look at, listen, endometriosis, there are going to be major problems that are going on that way. And then I started to dig in some of the research. The internet was starting to become big. And I can honestly tell you, I love to read medical research. And let me tell you something, medical research and medical practice do not match up. Now you say, well, doc, that's a very bold statement. You're right. Medical research, that they will dig deep and even look at certain things, but if it's not clinically applicable to them with drugs and surgery, doesn't make medical practice. Even though the medical research shows some things that are very valid to see them move to the next stage. And here was the research article I read. And let's take a look at it that way. Sex hormone binding globulin and thyroxine binding globulin levels in premature, and just for you guys that don't know what that is at the end, it's, premature budding, both in young boys and young girls. So first of all, I had to go, went back to my endocrinology books and things like that, talking about sex hormone binding globulin and talks about thyroid binding globulin, and realize that as estrogen, estradiol, or other forms of estrogen start to elevate, it can bind to sex hormone binding globulin, but also it can connect to thyroid binding globulin. So even if there's a thyroid issue, that could stem into actually, guess what? Cyclic issue. Now, if you look at what happens in healthcare today, they don't look at the body the way that we should. And I love analogies because I love analogies from a simple standpoint. It's easy for patients, and that's what they're really made for patients to understand this. And you guys should use this. The analogies I've created through the years, I'm going to talk about a couple of them, but here's my favorite one because it helped me the most clinically. You always have to look at the body like a Swiss watch. All these gears work together. They are not independent. If you look at the smallest gear here and talk about its working, if it stops working, it affects the whole thing. It doesn't mean the watch will stop, but maybe the second hand will be a little bit off. Maybe the middle hand will be a little bit off. Maybe but you go by a couple of days, it's dramatically off when it comes to time. And I find it funny in healthcare today that we are so focused on one gear. And if you don't believe me, look at the doctors and how they're actually even titled. An endocrinologist, cardiovascular. You look at a gastroenterologist, a podiatrist. See, what they do is they separate the body into gears. But that's not how the body works. No part is independent. If you kind of look at this right here, I want you to put that up there, Travis. I want you to take a deeper look at this. It's nothing more than all those gears that work together synergistically And the thyroid could affect the uterus and estrogens. Estrogens could affect the thyroid. Respiratory could affect the skeletal system. Immune system can affect the nervous system. Nervous system can affect all of them. And I was like, oh my goodness. So I started to dig deep a little bit more and say, oh my goodness, there's markers. So I wrote down, guess what? I wrote down sex hormone binding globulin, and I wrote down thyroid binding globulin. And I was like, these two things need to be measured to get a clear picture of not only the condition of endometriosis, but basically all anabolic hormone issues and also all thyroid issues, because that shows you that estradiol, estrone, estradiol metabolites can be affected, can affect thyroid binding globulin itself. That means higher level of estrogens can actually affect thyroid. Thyroid processes can affect the estrogen issues. So that's why when people say, Doc, I have a thyroid issue, I'm like, okay, let me see your estrogens. What? Why would you want to know I'm not worried about this down here. I'm worried about this. No. It's all connected. It's all connected. There's multiple gears that do that. So then I started to look at her other labs and realized that I said, hey, as I was investigating this, I said, hey, Christy, which is my wife's name, I said, I want to check your thyroid. And she's like, I already had it checked. And I was like, okay. She goes, yeah, but I've gained weight. I've had all these things going on. And they told me that what? My doctor said that my thyroid is what? Normal. And they said it was normal because even though she looked like she even presented with some thyroid issues, the doctor said it was normal. But you'd probably never guess the marker that they had when it came down to her thyroid. They had TSH. Now, let's look at this, because right away I'm like going, all right, great. I see your TSH, but let's kind of dig deep at what it really is. So I started to go, okay, and this can be pulled off from Reddit. I didn't pull this off 24 years ago. This is more updated information, but it was still well known. You know, what is TSH? It's thyroid stimulating hormone, triggers your thyroid to release its hormones. And I was like, release its hormones, which mainly impact your body's metabolism. High TSH levels usually indicate, I love that word usually, because you can have normal TSH and still have hypothyroidism. And low levels of TSH really are to, once again, hyperthyroidism. Now watch, thyroid stimulating hormone commonly cause TSH are also referred to as thyrotropin in the hormone that the pituitary releases to trigger your thyroid to produce and release its own hormones. Come back to me on trial today. Now think about this. So I looked at Christy and I said, listen, I have a marker for your pituitary. I do not have a marker for your thyroid. And she sat there dumbfounded. So I started to actually walk around, and because I started to walk around this even before I was in practice, asking women, say, hey, listen, you know, do you understand that the term estrogen is not a hormone? Estrogen is a term that represents many hormones. And they're like, what, really? And then I started to actually ask women, I said, listen, is TSH a thyroid hormone? They're like, yep. I'm like, no, it's not. It's a pituitary hormone. Like, really? And see, I started to realize that how our current healthcare system started to view the body was dramatically incomplete, because they determine their medication based on TSH. But let's go on, as you can see here. But even listed, release our hormones, T4, T3. These two hormones are essential for maintaining your body's metabolic rate, the speed of which your body can transfer food into energy and use it. Okay. Now, let's just even look at what Mayo Clinic says. Hypothyroidism, symptoms of hypothyroidism can be different per person. And they often look like symptoms of other health problems. Because of this, the diagnosis of hypothyroidism doesn't rely on symptoms alone. Usually you have based on the results of your blood work. The first blood test typically done to diagnose hypothyroidism levels of the level of TSH in the blood. It's high. The test is done again along with the blood test for the level of T4, and the results of TSH and high T4 and T4 is low. The diagnosis is hypothyroidism. In some cases, the thyroid hormone T3 may be measured as well. So I got a question for you. Why isn't it always measured? Why isn't it always measured? So I started to write down T3, T4, and started to go, okay, my panel's getting bigger. And then it was quite interesting because as I continued the process and looked at these things, let's take a look. And just once again, you can pull these up on the website. And as I started to read it, I'm going, oh my goodness. As you can see, it was measured, and let's keep going. The second test, you can see, is going to the middle page. Shows high TSH and T4 and T3 are standard range. They are diagnosed with clinical hypothyroidism. Okay. It usually doesn't cause any noticeable symptoms. Well, it's kind of interesting. So not only the fact that TSH could be elevated, but T4 and T3 could be normal, so it throws everything off. So I started to really dig deep a little bit more and go, hey, listen, there's so many factors that contribute to this. And you can see here, there's also something that can happen up at the hypothalamus that will change the release of TSH. And then you're going to get T4, T3. Wait, calcitonin is produced. And some other significant hormones. And guess what happens? I started to realize that I had some light bulb moments. That the way that they were evaluating all the things hormonally was actually made for one thing: clinical treatment, not clinical outcomes. Clinical treatment. Because they're going to test the things, because what they did is they always based their care on manipulating TSH. And then what they did is, because of what you saw there, all they want is TSH normal, because then they can sit there and go, okay, it looks like things are sitting good and you won't have any thyroid issues. I'm like going, that doesn't make any sense. Because if you look at all the other factors that can come out of it, it's not just TSH that determines. It's not just estrogen that determines what's happening with your hormones itself. There's multiple things that have to be measured in order to get that picture. So then I was like, okay, I want to see what they did for treatment of hypothyroidism. And they were going to prescribe her, once again, a form of medication. Now, back then, levothyroxine was not there, it was mainly Synthroid. So I started to look at some of the medications that they wanted her, they had her on, they wanted to prescribe her and stuff like that. And something hit me. I literally had a light bulb idea, because all of a sudden, if you look at some of the medications, you read the contraindications and read what they do, okay? I started to realize that TSH is not a thyroid hormone. So what I now need to do, and that was the light bulb moment, I need to dig even more. And as I was going through, I looked at medication, and one of the major medications that she was they want to put her on is a form of T4. Now, the most common form today is levothyroxine, but Synthroid is still given. But they always talk about contraindications are something that we got to be careful with, because they can do what? If taken during the time, but these things not checked, it could be a negative reaction. There can be side effects. Well, look at the contraindications. I want you to look at, glycerin hypersensitivity, obviously, because there's an ingredient in there. But look at adrenal insufficiency. Levothyroxine is contraindicated in the use of patients with diagnosis but untreated adrenal insufficiency. What? Initiation of thyroid hormone therapy prior to initiating glucocorticosteroid therapy may participate in acute adrenal crisis in patients with adrenal insufficiency due to the increased body's demand of adrenal hormones. Treat patients with adrenal insufficiency with replacement corticosteroids prior to initiating treatment with levothyroxine. So I started to realize, oh my goodness, let's go back to that Swiss watch. Let's go back to this concept. The adrenals can affect the thyroid. The adrenals can now affect the ovaries and uterus, and it's a thing. I'm going, all these things are playing together, and started to go, there's contraindications, which means that you are supposed to test the adrenals to make sure there's no low adrenals before you even give a medication. If you have any deficiency in your adrenals. Now, adrenal insufficiency is a medical term. Sometimes natural practitioners use the word adrenal fatigue. And then because doctors don't understand adrenal insufficiency, they say, there's no such thing as adrenal fatigue. No, it's just nomenclature. Idea is this: we know that we can measure cortisol levels to see if we have sufficient cortisol, sufficiency in adrenals. But get this, guys. So I started to do this. I started to ask patients, I said, before your doctor gave you the levothyroxine, Synthroid, or any form of medication, even Armour or Nature Thyroid or NP, something that's more given by integrative doctors, did they test your adrenals first? And patients gave like, what? What are you talking about? I'm like, well, according to their own medical research, you're supposed to have this done before you give out the medication. And patients went and read that, brought it to their doctors, and doctors like, we didn't know that. Not a joke, guys. So they come to my office, and I tell them this, and send them with their material. It's in the insert itself if you read the insert. And they'd be like, oh my goodness. Because it even says that you can put yourself in adrenal problems if you do not do it first. So that was eye-opening. I'm going, okay, listen, I gotta put cortisol on there. All right. But then I started to look at all the hormones, dramatic, from thyroid to our anabolics to progesterones, everything that way. And I realized, but let's even continue with the thyroid, that how would they look at the thyroid is dramatically incomplete, because I just showed that the adrenals, I just showed that estrogen levels, I just showed that a binding globulin, I just showed things can all interact and go back to this process and go, oh my goodness. So when people say I have a thyroid problem, if you don't look at all those factors that can throw it off, you will never determine what you're going to do with it. And then I came up with something and realizing that there's a 4-step thing you need to talk about when it does come to thyroid. And here it is. Look at production. Is it making enough? Look at conversion, because once you produce it, you still have to convert it. Destruction, interference. And I said, what if I could be the practitioner that can create the markers? Now, what I mean by create is put them into a panel so I can get a global view of those kind of things that help me direct what's really causing the factors and how I can actually get this thing back normal. And I started getting results back, and it was mind-blowing. Because, you know, even today, when I first started practice 24 years ago, doctors measure TSH. Now it's pretty much TSH, free T4, and free T3. But even that, even if they throw in T4 and T3, it's still dramatically incomplete. Because we know thyroid function affects everything. I can list all these things out what affects. It goes, hey, listen, all these things. And that's why when people say, Doc, how do I know if I have a thyroid problem? Well, there's so many things that can happen. It's dramatic. It's dramatic. And so if you think about it this way, with hypothyroidism, trouble sleeping, tired, difficult, skin changes, constipation, all these things. Hyperthyroidism, it's a little bit of the opposite, but it's the same thing. And if you look, there's a cascade and there's a dance between different organs that do that. There's from the hypothalamus, so there's got to be something from the brain that can affect thyroid function. We got to measure that. There's actually things with the thyroid itself that can stimulate it, and then T4 and T3 production. But then guess what happens? But by knowing that, you start to look at those 4 processes of production, and in conversion, there's things that you need in order for that to convert. See, you even need you need iron, iodine, tyrosine, zinc, selenium, and the other essential vitamins in order to do it. And so I sat down and I'm like, I'm just going to write all these factors down. I'm going to write down, see, let's get T4, let's get T3. But then realize that all of a sudden, if cortisol levels are elevated, your body will convert and reverse that T3, because people do not realize, synergistically, as the adrenals go up, the thyroid has to come down. If they both go up synergistically together, it can actually cause a heart issue. That means, think about this. If you have acute stress, do you know by nature your thyroid has to go down? And if you measure your labs at that time, you can see the hormone levels go down. And you can even keep TSH normal because the body's saying, don't push it out. Don't push it out. You're going to cause a problem here. And they call that clinical hypothyroidism. Like, no, that's actually stress. And see how we look at the lab and understand how it interacts. Because if you just did this, if you took TSH and it was normal and T4 and T3 a little bit low, they say, yep, hypothyroid, put it on medication. But the body didn't make a mistake. The body's trying to keep it down so it doesn't cause a heart problem. And that's why if you see one of the negative side effects of levothyroxine, Synthroid, and any thyroid medication is heart issues. Because if their adrenals are too stressed out and you push the thyroid forward, it's a bad day. Who says so? The medication itself. See, that's the Swiss watch concept of when you look at a lab, that guess what? T3 may be down because it's supposed to be down. T4 may be down because it's supposed to be down. But you can't tell that without getting the other things. And let's say when you just take out these other productive things, there's T2, there's T1, there's calcitonin. And if you just look at the standard treatment of this, how does Synthroid replace even all these? It's just a T4 medication. See, so that alone gave me an idea if there was some production problems and to dig where it could have been coming from. But then guess what? Once produced, what does it do? It has to convert. You saw part 2, convert. You notice that, for example, T4 is the majority of the hormones produced by the thyroid. And then all of a sudden, if you see a very low T3, you think, oh my goodness, it's not converting. Are we minerally deficient? Do we have certain toxins? Heavy metals can actually interfere with conversion. But if you understand that 80% of the conversions come within the organ right there, the liver. So all of a sudden I can go, okay, listen, with that Swiss watch principle, we can go, there's a liver problem. So we will probably need a lipid panel. So Doc, you're telling me that we need to add more things than just picturing the thyroid itself. Yes, if you truly want to be a doc to investigate to where the things are coming from and how to get that person back normal, because you also get to see a kidney issue where a lot of that converts also. But think about this, liver. Do you understand that liver health is directly connected to thyroid conversion? So that's when people say, doc, they check my thyroid, it's all fine. I'll say, can I have your lipid panel? Like, what? Well, I need to see all the factors that can throw it off. What do you mean throw it off? Or they also do this. Here, watch this. A person can have a normal TSH, a normal T4, and a low T3. And I've seen this by integrative doctors and I've seen it by medical doctors. They'll give them a T3 replacement. I'm like, does that T3 replacement replenish those deficiencies to make it normal? Does it help the liver or kidneys to make it normal? No, actually, the medication itself can hurt those things because all medications have negative side effects because they're still listed as a toxin. But wait, I always love the commercials, but wait, there's more. Destruction, autoimmunity, and hyperthyroidism. Oh, I don't even want to read this first sentence for you. Hyperthyroidism can be induced by various diseases. An autoimmune cause accounts for approximately 90% of adult hypothyroidism. Hold the phone. What? So you're telling me, after I just convinced you that there's these conversions, these problems, there's multiple factors, 90% of hypothyroidism is a destruction problem? First thing I ask you then is, how does Synthroid, levothyroxine, NP, Armor, any of the medications, even if they're given by integrated doctor, even though a little bit more safer, even if it's a desiccated gland, how does it address the immune issue? How does it address the immune issue? It doesn't. So regardless of your replacement, even if it's more integrative, you are not having a complete look at the thyroid and what really affects it. And if you think of it this way, autoimmune diseases are all-time high. Autoimmune diseases are all-time high. And look at Hashimoto's and Graves', the two hyper and hypothyroid issues are two of the top 4. And people wonder why. I have clinics all over the world. People wonder why I actually have gotten asked to speak on every medical stage, every chiropractic stage, every naturopath stage, all these big things, all the schools call, is because I've given them an idea from a Swiss watch principle, looking at the body from a Swiss watch principle, that they're all these gears interact. And it makes so much clinical sense to say, listen, we need to get these things tested like you do, doc. You're right. Because when you look at all those common autoimmune disorders, here, watch this. The immune system is vital. It protects the body from disease, but fights off pathogens. When a person faces problems with their immune system, it can overproduce antibodies and send the body into overdrive. The system mistakes healthy tissue for invaders and being attacked healthy tissue. The cause, the triggers of the autoimmune disease are largely unknown, although millions of Americans live with them every day. Guys, let me tell you this. They all have it wrong. Your body doesn't make a mistake. Your immune system responds to what's happening there. And it's big time. That's why if you look at how they list an autoimmune disease, what happens? Immune system usually guards against bacteria and viruses. When it sends these foreign invaders, it sends out an army to fight cells to attack. Yes, yes, and yes. I love that. But let's go a little bit higher on there. Autoimmune diseases are conditions in which your immune system mistakenly attacks your body. It doesn't make a mistake. That is the biggest thing. It does not make a mistake. And if you look at this NIH, let's take a look at this one. Overall autoimmune disease, the immune system is a network of cells and tissue throughout your body. It works together to defend you from bacteria, viruses, and infections, and it kills off invaders that might harm you. Autoimmune diseases refer to problems that acquire immune system reaction. The immune cells target cells are healthy tissues by mistake. Nope. I can go on and on. Mistake. Your body did not make a mistake. Your immune system, once again, having a high TPO antibody, having a high TGB antibody, having a high TSI antibody, which is all measurable, shows that there's markers that those cells that are not healthy, your immune system does not attack healthy cells. Your immune system is triggered to go after the flags, the receptors that say, hey, there's a problem here. But because they don't deal with it, they don't look for destruction. They say it's a mistake. It's a mistake. It's not a mistake. These things are done for the purpose of the immune system recognizing that there's a foreign invader. You look at this, immune system, foreign invader, virus. So could a virus go into the thyroid like EBV, Epstein-Barr? And could it trigger some of the thyrocytes that now TPO antibody is elevated to attach to destroy those thyroid cells? Absolutely. It was a mistake. So when you see high thyroid antibodies, but once again, let's take a look at the lab. I had to go TPO, TGB, TSI. We had to look at all those other factors that led to it and things that can contribute to it. See, if we just take a look at that panel that I created, and it's nothing more than having the concept of the body doesn't make mistakes, and I want to see what it's doing, and I want to see what all the organ systems are doing that interact like the Swiss watch principle, that we can now start to dig back, and it teaches us, by our lab like this, we can observe what the body's telling us. Because you know what's really funny? Our current medical approach to the thyroid, or we can use almost every condition on the planet. I could actually prove this if I taught you more than just the thyroid. It's incomplete. It's incomplete. So are they wrong by measuring TSH? No. Are they wrong by measuring T4? No. But without looking at production, conversion, destruction, interference, guess what happens? I can teach you a seminar on every one of these things, just 4 seminars right there, 8 hours of time to really dig deep. So when I put that panel together, I was trying to give clinicians a great global view, but some really extreme detail, more than any detail of any clinician that existed before me. And I mean that humbly, because I was put in a position to where I fell in love with this beautiful woman and I wanted to build a life with her. And the medical people and the natural people, she was taking 25 supplements, getting adjusted, doing all these things. She saw every medical doctor. She saw the fertility specialist, and they all actually did their very best, but they made judgments on the body with an incomplete view, and they weren't looking at the factors that could do it. So it's kind of nice as I continue to put the markers on there, and I found out what was causing and the factors that led to, which are multifactorial. I don't even like when any doctor, natural or medical, alternative or integrative, say we go after the cause. I've never met anybody that had one cause, period. I've never met anybody that had one cause. There's always a combination of multiple things with multiple organ systems having a factor on that can lead to a destruction of one organ. But I can show you from the thyroid that adrenals are going to be off, and then liver's off, and then the immune system is a junk, and this thing. And wait, we're not on social media, otherwise I'd kicked off for this. The past 3 years, and especially the past year and a half, thyroid antibodies are all-time high. I can actually legitimately show you research where they're saying, listen, the COVID vaccine has contributed to massive autoimmune disease when it comes to the thyroid. So what you're saying is there's destruction done. Destruction. By a medical tool that they say safe. It's not safe and effective. It's actually very destructive. And now that's why you see more autoimmune diseases in the last year in history. See, but I don't look at it as a problem. I look at it as an opportunity to go, listen, you're going to be misled. You're going to give incomplete testing. You're going to not have all these things answered. And if you can take this panel and run on your patients, you're going to have better direction and better outcomes than anybody around. And being a doc, just by being a student at the time that I met my wife, I wrote this panel and it changed our life. So am I passionate about it? Absolutely. Those 4 girls would not be here if it wasn't for the concepts and stuff that I put together and developed and the analogies that done it. And now medical doctors, pharmacists, GPs, OBs, chiropractors, naturopaths, every professional, nurses, nurse practitioners, they say, hey, can I get that panel? Just like the breast cancer surgeon today said, that's an amazing panel because it gives such a complete view of something so devastating in people's lives. Yet the medical field is so narrow-minded and incomplete on their assessment that their treatment actually is just a drug. But see, this panel does not form well for their medical practice. I can pull every PubMed article up in the world, every research article in the world, proving what I just showed you. I just use drugs.com for even showing the contraindications. But because it doesn't match up their medical practice, their medical research never makes it into everyday life. We have this opportunity and been doing it 24 years. 24 years. And I'm very excited. I'm very blessed that Access has worked well with me to do it and actually gave us an amazing price on the lab. We all pay the same thing. I don't get anything special. But it's kind of great because they're special because they sat down as a doc, put it together for us. And would you share this panel with all of their docs of all professions? Absolutely. Because if we can get all these doctors doing this stuff, it'll make a great change on people's hormonal health. So I actually finished up a couple minutes early. So what I want to do is this, I hear that we do a half an hour roughly of a presentation, and then we do question and answers for roughly half an hour. So I guess we would know if anybody had any questions for us, and I'm here to answer them for you. And to give you an example, here's an example of a lab that, once again, you can see it's done by Access. I'll keep the name covered so you don't see it. But everything I just talked about is right in these pages. And to give you an example, she is let me see here. She's a 15-year-old female that won't stop bleeding. And their doctors couldn't figure it out. We ran the panel. Guess what? I know exactly what caused it. And Dr. Jason brought this to me and said, hey, look, Doc, here's probably a good one that you can talk about for your training tonight. But you think that I was the first doctor, or one of my clinics was the first doctor to come and see? No, they think we're quacks. Yet, because of the amount of sick and suffering, that child has been through multiple doctors, through multiple systems. And now when the parents saw that lab, which was today, they were ticked. They're like, why didn't my other doctors run this? It's right there. I'm like, remember, their viewpoint on why your daughter is bleeding every single day at 15 years old with a menstrual cycle was incomplete. I said, I actually feel sorry for them. I don't get mad at them, feel sorry for them. That their profession limits their ability to even look the way we do. So, yeah, there, I made it to their half an hour.
Dr. Flynn,
Right,
what an amazing and educational lecture, sir. We truly appreciate you. We do have a few questions here. So question number one, I guess I'll segue what you just stated. So we have here, based on what you order for blood work, I feel as I only order the basics on my patients.
Yeah.
Can you provide guidance as to how to interpret more extensive tests such as pregnenolone, RT3, estrone, estriol, and DHT?
Absolutely. Okay, if you look, some of those you have to look and go, and let's say all of a sudden that you do this. Let's start with DHT. Is probably very easy, because if you do it with any males, you're going to deal with, prostate problems, benign prostate hypertrophy and stuff. And that can come from two things. That can come from DHT being elevated or estradiol elevated. So now, what's the interpretation of that? Because what would you do? Well, that shows you that there's a conversion problem. See, so now you step back and go, okay, where does DHT, where does the hormones aromatase, and what causes that? So, for example, a lot of people don't realize that the number one thing that causes, in males especially, your testosterone to convert to estradiol and estrone, which people do not realize. Testosterone does not cause prostate cancer. Estrogens do. Because your testosterone is the highest when you're 15 to 30, and if you're under our care, it'll stay good the rest of your life. Why didn't you get prostate cancer young? Nobody gets prostate cancer young. Very rare. But see what it does, it converts. And to give you an example, I just had a recent lab, and this is very common. You'll see lower testosterone levels and higher estrogen levels in man. That's why you see weight and augmentation in breasts and everything like that happens that way. And number one thing that stimulates that is glucose, sugar. So from that lab, you say, hey, you need to stop all your sugar intake. That's when I came up with some of the concepts of how men's testosterone drop just from seeing it convert from testosterone to estradiol. Just like converting from testosterone to DHT, there's conversion problems. If you look at pregnenolone and where it is made, and that's why even the lipid panel is important, because what happens is those lipids have to be transported to what? Transported to certain organs, including the adrenals, to get your pregnenolone done. That's why it's called the mother hormone. And then it distributes to all the body. And that's why I hear, watch this. If you have any hormone problem, you're going to have an LDL problem. Why? Because you have to transport cholesterol to all others. And so when people see elevated LDL, it shows me that you are probably hormone deficient, and you got to extract that cholesterol from the liver to get to other organ systems. And people want to reduce LDL. I'm like, no, it's just an observation. Your body's saying, I know what I'm doing. I'm not making a mistake. I'm going to raise my LDL to get more cholesterol there, so produce more hormone, have more repair. I'm going to lower my HDL because I don't want it coming back here. I want to leave in circulation. But the current medical field said, that's bad. It's like, oh my goodness, they are so misguided because they look at this as like a mistaked machine. It's brilliant. See, and that's where you have to have the concept that the body doesn't make mistakes. It's trying to survive every stressor on the planet that you did to it.
Now, on that, let me ask you, do you treat one condition at a time, or do you just tackle it all at once?
Well, there's no way you can treat one thing at a time. And let me show you how the side effects of medications work. See, the concept side effect is perpetuated and lied from a standpoint of this. So let's use an enzymatic pathway, okay? Let's say in our liver, we're trying to convert estradiol to estriol. That's actually a P450 C3-4 pathway, okay? So what happens is when you look at this, something like a medication can actually stimulate that process. There's some medications that can inhibit that process, 3-4 pathway. Now, here's what happens. That all of a sudden, if they try to manipulate that to make it change, there's other parts of the body that have what? They have that same enzymatic pathway in the GI, in the brain. And they say, well, we don't want those things to happen because those other gears are still affected by us. So we'll just call them side effects, and we didn't want them. They're just natural consequences and unwanted effects of your drug trying to manipulate one organ. Do you understand that that's why when you actually do make any change to your body in a positive way from our standpoint, you by nature affect all the other organs. So there's no way you can just work at one thing at a time. It's impossible because the gears, one gear doesn't stay bad and the rest of them start going good. The one bad one will still do what? Keep all the rest of them from being good. So it has to be a whole body approach. That's why medicine will never figure it out. Medicine cannot accomplish health. Integrative medicine cannot accomplish health because they're so unilateral on their one gear thinking. Excellent. Or watch this. Functional medicine. Let's start in the GI. Really? Really? We're going to start? ESN? Yeah, we're going to work on the GI and then we'll go to a different system. It doesn't work that way. My goodness, that's such a false representation of how the body works.
So we appreciate the answer. So all in all, we have to tackle it all at once.
Yep.
Excellent. Excellent. One of the viewers wanted to know, the 15-year-old female, what was the indicator that you saw for her constant bleeding? Or were there numerous indicators?
Well, there's multiple ones. Now, I'll give you an example. Her estradiol, which they've never even measured, okay, was at 261. And the thing was this, her estriol was actually non-existent. So she's not converting to her weaker form. Her progesterone is actually at 0.1 being low in the follicular phase that she was in. Luteal phase that she was in when she ran the lab. And what ends up happening is, so she had a deficiency in progesterone because now watch, progesterone is not an end-stage hormone. So therefore, progesterone can convert to cortisol and cortisone. Her cortisol was normal, but her CRP was elevated. So CRP is one of our major inflammatory pentaproteins that come from our liver. So therefore, cortisone being needed to put out that inflammatory response started to drain her progesterone. So we knew that there is something inflammatory within her system, and she had an immune reaction, which is draining her progesterone. Now, because there was no breaks to the estradiol metastasizing things like crazy and producing a thicker endometrial lining, and it couldn't convert to the weaker form of E3. So she had a conversion problem. She had an inflammatory problem. And guess what happens? So we started to change that. So we have a nice plan for her to actually increase those conversions. We actually decided to run a couple more labs on her to find the inflammatory markers. And then what we're going to do is we're going to support her body through that process in order to actually not only get balance and homeostasis to it that way, but it's going to give us a little time to actually figure out the inflammatory markers that she does. So it guides you to even more.
Poor young lady. Well, I'm very glad that her family has found you. And on inflammatory markers, so one of our viewers wants to know, it seems like they're struggling, right, with inflammation on their patients. What do you recommend for someone who's struggling in decreasing inflammation on their patients?
Well, remember, if you now step back and understand what inflammation is. In general, it's an immune response to some trigger. It's immune response to some trigger. See, just like, Hashimoto's would be considered an inflammatory response because the immune system is conglomerating to the thyroid and destroying some of the thyrocytes because why? They've been triggered and they leave a flag to say, listen, I need to get destroyed here. And if you look, there is things that trigger the immune system can be bacteria, viruses, foods. You look at trauma itself. Okay, for example, let's do this. Even if you destroy a joint, there's an inflammatory response. There is. And so therefore, chronic inflammatory problems with your joints is an immune trigger. That's why, once again, that's why the GI has become so popular in functional medicine, because there could be a bunch of immune triggers, but they're not the only immune triggers. Vaccines are immune triggers. That's why if you notice, once again, you can actually, even with the toxic metals that they put in there, they can eliminate thyroid, and that can lead to destruction. So it's about digging for those immune responses that led to that inflammatory response in the first place.
Excellent. Now, there seems to be one of the viewers understands all of the tests, it seems like, that you've listed as a whole, but they're having a little bit of trouble with the ferritin component. If you can speak on how the ferritin ties in with all of the other tests.
Ferritin is used to convert T4 to T3. So that's why I have that in there, because it can lead to some deficiencies that can leave the conversion not happening. Because conversions happen in the liver, but you also need zinc and ferritin and things like that in order to convert it. And that's why it's very common when you do with cyclic women for them to have iron capacity, iron saturation, and ferritin issues. And so therefore, and do you know what one of the major things why ferritin is so important? Because if the thyroid needs to kick in for metabolic rate, it goes towards its ferritin reserves to get its conversion. And I can honestly tell you, I'm looking more for ferritin for the thyroid than I'm looking for ferritin for anemia.
Very interesting. Thank you for sharing that, sir.
Yeah, so do me a favor. If you just you want to go back and look at the diagnostic of it. If you look at what's needed to convert T4, T3, you need ferritin. You need ferritin. Just understand that.
Excellent. You know what? That's a different angle to look at, right?
Yep.
Which, like you mentioned earlier, not many providers look at it from that perspective.
Yep.
Excellent. So, Dr. Flynn, you know what? That's it for all of the questions that we had in the Q&A. Like I mentioned earlier, truly an amazing, educational, eye-opening experience. We appreciate you, appreciate your Wellness Way team. Thank you again for your time and for joining us on Access Live. Now, for our audience that wants to be able to reach you, right? Our audience that wants to pick your brain, maybe someone that wants to get to know the Wellness Way and Dr. Flynn, how do they get a hold of you?
Well, what I would do is you can honestly, since we're all colleagues and we all have one goal, is to actually get the best clinical outcomes. If you do have a question, do me a favor, you just text me. I'll give you my number, and please do me a favor, please don't give it out. But I'm giving you guys the opportunity to be able to just, man, I'll tell you right now, obsessed with clinical outcomes. And these labs become so important. And if you have that obsession like I do, 24 years, thousands of doctors trained, ton of offices all over the world, send me a message, really honestly, because if I can give you a little bit of advice and you now can have a perspective that you can share with the patients, your practice will not even explode, but you'll be able to get fulfillment that most doctors dream of. So send me a text at 920-660-7877. Do me a favor once again, 920-660-7877. And do me a favor, just let me know that you heard me on the webinar and let me know your name and where you're located at. And if you're struggling with some clinical outcomes of the patient and you do have some labs, please do me a favor, email them to me at pflynn, so P as in Patrick, Flynn, F-L-Y-N-N, so F as in Frank, L-Y-N-N, at thewellnessway.com. The Wellness Way is just my clinics that I own all over, thewellnessway.com. So pflynn at thewellnessway.com, and let's get you on the right path. And right path, for example, is nothing more than all of us doctors coming together for the sick and suffering people out there, because what's happened medically in the last 3 years, they need you even more. They need you even more, because the last 3 years proved that they're trying to push an agenda that will never get these patients well. Never, absolutely not. It actually just makes them worse. Go back to my videos. You can follow me on Instagram or YouTube or any of that. Go back to my videos. I predicted autoimmune disease all the time. I predicted cancer all the time. Based on the concept of what it does to the immune system, which is actually really my background. My background, actually, when I was in college, was actually immunology and nutrition. I decided to become a chiropractor because I looked at the medical field going, you kind of got it wrong. And now I've been able to prove that clinically. And I speak at medical schools, and I speak at naturopathic schools, and I speak at chiropractic schools, and I speak to the public at large events. And you'd be surprised. I speak more at medical seminars than I ever do that something would be called natural integrative. Because you know why? Because even functional medicine doesn't look at it this way. They still look at the body like it's a broken down machine. And that frustrates me. That frustrates me because they almost have it. They almost do. But look at the term, functional medicine. They still have a medical approach that still doesn't allow them to let go of some of the views they have. They just move toward more natural things. But you can have all the natural things in the world. We have more natural remedies, and we have more herbs, and we have more medical treatments in history, and people are still getting sicker because you need to have the thought process first to work this out. So that's how I can get holding.
Dr. Flynn, we thank you again. Love what you stand for. Love what the Wellness Way stands for. Thank you again for joining us on Access Live. Thank you to you and your team. Thank you to our audience for joining us. Until next time.
Have a great day, guys.
Thank you.